Welcome, everyone, to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, can you imagine losing your voice?
Happens sometimes.
Well, you know, I don't even think your husband would like that for very long. But just kidding. Well, it does happen. And the vocal cords can stop working. And paralysis of the vocal cords occurs when the nerve impulses to your voice box, also called your larynx, they're disrupted or for some reason. And if the nerve doesn't work, the vocal cords don't work.
And that can affect your ability to talk, even breathe. And here to tell us more about vocal cord paralysis is Mayo Clinic ear, nose, and throat specialist, Dr. Dale Ekbom. Welcome to the program.
Thank you very much for having me.
Good to have you on the program. So tell us, we take our vocal cords for granted, most of us. Tell us a little bit about the vocal cords.
Yeah, they're very complex. It's really amazing because the vocal cords, they have many layers to them, and the outer part of the vocal cords is a vibratory layer that allows you to just, have that beautiful sound that you can create, whereas the deeper layers are more of a firm ligament, and then there's muscle beyond that. So it's really hard to replicate that, research-wise and everything, and it's pretty amazing.
So they do a couple of things, though. They allow you to speak and to talk, but they also protect you from aspirating something, right?
Yes.
They stay closed, so when you chew and swallow, it doesn't go down your trachea.
Exactly. When you swallow, the vocal cords come together and they protect your airway. You don't want anything down there because that's aspiration or could result in pneumonia. So that closes down nicely, and then you just are able to pass the food along the sides of the larynx down into the esophagus. And so it's pretty neat. Vocal cords, they vibrate anywhere between 100 and to 1,000 times a second. So it's pretty amazing how fast they're vibrating.
When I have laryngitis, or if you have a sore throat and you sound hoarse, is that your vocal cords?
Yes, the vocal cords typically get swollen when that happens. There's some redness, there's inflammation, and then the voice often deepens a bit and becomes rough with the laryngitis.
So what can cause the vocal cords to stop working?
Well, yeah. So we see vocal cord paralysis quite a bit in my laryngology clinic, and there's lots that can cause it. The number one thing is probably surgery of either anywhere along the course of the nerve that goes to the vocal cord. So skull-base surgery, neck surgery, chest surgery, any of that can cause vocal cord paralysis.
So for whatever reason, that nerve is damaged.
Yes.
Is that the recurrent laryngeal nerve, as I recall?
That's it.
And it supplies the vocal cord, the muscle of the vocal cords.
That's right.
Yeah.
Yes.
And usually this would be on one side?
Yeah, usually one side. You can have it on both sides, but typically if it's a surgical thing, it's one side. Other causes can be, tumors, we call it neoplasms, and anywhere, again, along the course of that recurrent laryngeal nerve. And
just puts pressure on the nerve.
And puts pressure on the nerve or infiltrates the nerve, and takes away the movement of that vocal cord. And probably the third category, so tumors are the one of the categories, surgery is another, and then the third category would be this idiopathic or unknown cause, where it can be a virus most likely.
If it's caused by surgery, does it recover? Does that nerve recover most of the time, or it can actually be cut where it doesn't recover?
Yeah, if it's cut, it never recovers. If it's stretched, it can recover maybe half the time or less than half the time. So, and sometimes recovery can be improvement in voice, but just a more midline position of that vocal cord that's paralyzed. And so it still doesn't move, but you can get a voice again just by it moving to the middle. So that's how that works.
Yeah, and so you have some options. If that nerve never recovers, what can you do to restore a fairly normal voice?
Yeah.
Say that again. I missed the part. You said that if that vocal cord doesn't work, if the nerve to that vocal cord on one side is paralyzed, what does your voice sound like? Do you have a voice at all?
Yeah, so some people, and most people, end up having a breathy sound, almost like a voice like this, kind of a whispery sound to their voice. Some people have rough voice, and other folks can have a pretty good voice. It really depends on where that paralyzed cord ends up. If it's more of a lateral or out position, then the other vocal cord can't connect to it.
Yeah, okay.
And then so you have that breathy sound. Whereas if it paralyzes and it ends up being more in a middle position, you can actually get closure and can have a voice that is pretty close to normal in some, or at least 80%.
And how do you fix this? How do you solve this problem?
Yeah, so there's different options. It depends on when it happened. We do have to some of these vocal cords start moving again over time. So it can take...
When the nerve recovers.
Yeah, yep. And so you have to think about waiting anywhere between 9 months to a year, and sometimes you can have recovery even later with that. So we don't do anything permanent in terms of surgery until it's been close to a year. But in the meantime, we do a lot of vocal cord injections. And so that's kind of our temporizing measure. Some of those end up lasting long term for patients.
Now, what does that mean?
Yeah, how does that work?
Yeah, so vocal cord injections, we inject the vocal cord either awake or asleep, and we do it with collagen as one material. Another material is hyaluronic acid gel. That's called Restylane. So there's different materials with fat sometimes. So there's
Does
different
it
material.
change the sound of your voice?
Yeah. So then what happens? Yeah, it's amazing because it pulls it. It just injects into the cord and then pushes it more to that midline position.
So the other cord can meet it.
So the other cord can meet it.
Wow.
It doesn't cause movement again. It just gets it more to midline.
Oh, pretty neat.
Yeah.
And what about the surgery? What types of surgery do you have available, and when do you choose to employ that?
Yeah, so surgery, that's after it's been about a year, we start talking about the permanent options that we can do. One of them is an implant. It's called thyroplasty, where you actually carve an implant or layer in an implant. We go and operate, and we actually go into the neck, create a little window at the level of the thyroid cartilage, and then push this implant in. So again, it pushes the vocal cord more to the middle, and then the other side can connect to it, and that's a permanent thing. So that's
What is that made out of?
So that's made out of silastic is one material. Gore-Tex is another material. A ribbon of Gore-Tex is used sometimes. Those are the main two.
Wow.
Yeah. So
Is voice therapy part of this? I mean, either before or after?
yes, sometimes it can be. If you have a patient that has fluctuating voice, like if they're more towards the middle, with their vocal cord and they're connecting fairly well, but they say, boy, the voice is like 90% sometimes and 50% other times. Well, then a speech language pathologist can work with them and get them to more of that 90% more often. They work on the muscles of the neck, the airflow, the resonance of the pharynx, other things to...
People that want to change their voice, can you surgically do that? I'm
Yeah.
thinking specifically about people that are transgender that want to change their voice.
Yeah.
Does that happen?
That is being done. We just have to be a little careful on that because how it's happening right now is they're tightening up the voice or creating webs up in the front part of the vocal cords, then shortens the and actually makes them a little tighter so you can increase the pitch.
Really?
But you start losing sometimes with vibration and other things. You can end up with roughness, and so I personally, what I recommend for those folks is to see our speech language pathologist, work on changing pitch that way instead of surgically right now.
Somebody who works with vocal cords all the day, do you get distracted by listening to people's voices?
Yeah, no.
I bet you do.
I think I can hear voices, and and I can hear if someone has a problem. I think to myself, I'd like to see what their vocal cords look like. It's a quick little flex scope. We can look down there and take a look.
I've never been able to sing. Can you fix that?
Sorry, Tom, you can't fix
ear.
that one.
That's an ear thing, I think.
And one last question. Do you ever try to repair that nerve that goes down to the vocal cord?
Yes, yeah, we do. That's another permanent option. So one is that implant that I was talking about. The other is called reinnervation. You can put a branch of a nerve that goes to your strap muscles into that nerve that goes to your vocal cord and connect them. It does not allow movement of the cord, but it allows for really nice bulk. And it works well in younger people, especially where the nerve grows back faster. And the bulk affects not just an implant pushes right at the level of the vocal cord itself, but like a reinnervation will infiltrate all the nerves that go to all the different muscles around the larynx, that are innervating those vocal cords. So, wow. and what allows it to move open and closed and everything else. So it's pretty amazing what that can do.
All right, Dr. Dale Ekbom. He's an ear, nose, and throat surgeon at the Mayo Clinic. Paralysis of the vocal cords, difficult problem, but sounds like you've got a lot of options for treatment.
Sure do. Thanks so much for talking about it.
Thanks for joining us, Dr. Ekbom.
All right.